Understanding personality disorders, a comprehensive narrative. Personality disorders represent one of the most complex and challenging areas within mental health, affecting millions of individuals worldwide while often remaining misunderstood by both the general public and healthcare professionals. These conditions are characterized by enduring patterns of inner experience and behavior that deviate markedly from the expectations of an individual's culture, leading to significant distress and impairment in personal, social, and occupational functioning. The development of personality disorders typically begins in adolescence or early adulthood, though their roots often trace back to childhood experiences, genetic predispositions, and environmental factors. Unlike other mental health conditions that may have clear onset periods, personality disorders represent persistent and pervasive patterns that become deeply ingrained in an individual's psychological makeup. These patterns affect how people perceive themselves, relate to others, and navigate the complexities of daily life. Mental health professionals categorize personality disorders into three distinct clusters based on similar characteristics and symptoms. Cluster A disorders, often referred to as the odd or eccentric cluster, include paranoid, schizoid, and schizotypal personality disorders. Individuals with these conditions often exhibit unusual thinking patterns, social withdrawal, and difficulties forming close relationships. Cluster B disorders, known as the dramatic, emotional, or erratic cluster, encompass antisocial, borderline, histrionic, and narcissistic personality disorders. These conditions are characterized by intense emotions, impulsive behaviors, and troubled interpersonal relationships. Cluster C disorders, the anxious or fearful cluster, include avoidant, dependent, and obsessive-compulsive personality disorders, where individuals typically struggle with anxiety, fear of rejection, and excessive need for control or support. The impact of personality disorders extends far beyond the individual, affecting families, relationships, workplaces, and communities. People with these conditions often experience chronic difficulties maintaining stable relationships, achieving consistent work performance, and managing everyday stressors. The ripple effects can be profound, leading to broken marriages, estranged family relationships, frequent job changes, and social isolation. Understanding these broader implications is crucial for developing effective treatment approaches and support systems. Diagnosis of personality disorders requires careful assessment by qualified mental health professionals, as these conditions often co-occur with other mental health issues such as depression, anxiety, or substance abuse. The diagnostic process involves comprehensive clinical interviews, psychological assessments, and long-term observation of behavioral patterns. This complexity makes accurate diagnosis challenging, as symptoms may overlap with other conditions or be masked by situational factors. Treatment approaches for personality disorders have evolved significantly over recent decades, moving away from pessimistic prognosis toward evidence-based interventions that offer hope for recovery and improvement. Dialectical behavior therapy, cognitive behavioral therapy, psychodynamic therapy, and other specialized treatments have shown promising results in helping individuals develop healthier coping mechanisms, improve relationship skills, and achieve greater emotional stability. The therapeutic process often requires long-term commitment from both patient and therapist, as changing deeply ingrained patterns takes time and persistence. Family members and loved ones of individuals with personality disorders often struggle with their own emotional challenges, including frustration, guilt, and exhaustion. Support groups, family therapy, and education about these conditions can provide valuable resources for those affected. Understanding that personality disorders are legitimate mental health conditions, not character flaws or personal choices, helps reduce stigma and promotes more compassionate responses. Recent research continues to shed light on the neurobiological foundations of personality disorders, revealing important insights about brain structure and function differences that contribute to these conditions. These findings offer hope for developing more targeted treatments and interventions in the future. Prevention efforts focus on early identification and intervention, particularly during adolescence when personality patterns are still developing. Creating supportive environments, addressing childhood trauma, and providing appropriate mental health resources can help prevent the development of more severe personality disorder symptoms. The journey toward recovery from personality disorders is often challenging but entirely possible with appropriate treatment, support, and commitment. Many individuals with these conditions can achieve significant improvements in their quality of life, relationships, and overall functioning through dedicated therapeutic work and ongoing support systems.